So that's how, I have an example. There was, before me working in this position, I was a community health worker with our care team. And there was a lady that kept getting it readmitted in the hospital, kept getting readmitted. And nobody understood why. She wouldn't go to primary, she wouldn't go to her specialist. And one day, it took one person to realize when she was getting discharged that she couldn't read. So she didn't know. Nobody took the time to even realize to ask her, do you understand your discharge papers? What does that look like? And from that alone, she kept getting readmitted. So if you don't take the time to even speak to the people or find out, you know, do you understand your discharge? Is there anything I can explain? That's how health outcomes come. Because God forbid something else would have happened, it would have been worse from just not taking time to communicate with the patient. As a community health worker, it was just a lot of, it was like peeling an onion, I always say. It takes a lot of building relationships and having those conversations, because yes, we've had times that people wouldn't admit that they couldn't read or they couldn't understand. It was just letting the patient know that we're here for them and not giving up on their care and just supporting them in whatever they needed. And eventually they would open up and say, okay, this is what's going on. I can't read or I can't understand what this means. And it took time. It takes time. It's not something that happens right away. But at the end, it's all worthwhile once the patient starts opening up. So being in the community, working in the community, I have realized that patients have more comfortable talking to us than the providers. So we're like the middleman, trying to connect them back to the providers, trying to understand why that connection's not there. So patients do feel more comfortable and open more up to us. And then us trying to figure out how we can connect them back to primary or their specialties. Because at the end of the day, once we're not there, they're the ones that have to follow up with them. And that's who they should be providing the service.